Welcome to the Office of Public Health Practice webinar series, Career Conversation today. I'm Paul Irwin. I'm the Dean of the School of Public Health here at UAB. And on behalf of Associate Dean Lisa McCormick, we want to welcome you to this career conversation. Again, this is sponsored by both the Office of Public Health Practice and the Public Health Student Association. You have their websites there on the screen. Without housekeeping, it's my honor to introduce our guest today, Rosalind Robinson, who graduated with a Bachelor of Science degree in biology from UAB in 1997 and a Master's of Public Health degree in International Health and Epidemiology from our School of Public Health in 2001. Rosalind has been a part of the organ and tissue donation community for more than 15 years. She currently holds the position of the Assistant Manager of the Family Care Coordinator Program at LifeLink of Georgia. LifeLink of Georgia is a nonprofit community service organization dedicated to the recovery of life-saving and life-enhancing organs and tissue for transplantation therapy. Rosalind has also served as a regional representative and a member at large for the United Network for Organ Sharing on the Minority Affairs Committee. Rosalind is passionate about the mission of providing hope to donor families and donor recipients by supporting efforts to enhance the available supply of desperately needed organs and tissue for transplant patients and improving clinical outcomes of patients post-transplantation. In her free time, she enjoys reading, traveling, and volunteering with Camp Horizon, a camp dedicated to the restoration of dignity and hope to Georgia youth in the foster care system. It is her strong belief that we are all connected, and if one part of our community suffers, then we all suffer. And it only takes one person to make a difference that may last for an eternity. With that, Rosalind Robinson, welcome to our career conversation. We're so glad you could join us today.
Thank you, Dr. Irwin, so much for inviting me to be a part of these career conversations. I'm so excited to be able to contribute this way to the UAB Department of School of Public Health. Just to tell you a little bit about myself, you've said it all in your introduction. However, I am an Alabama native, but I love, very passionate about UAB and the Blazers and supporting UAB. My husband and I often attend events here when alumni events are going on here in Atlanta. We're oftentimes trying to get involved and connect with former UAB students and alumni. And we just enjoy the opportunity to do things like this. And thank you for inviting me to talk to your students today.
Certainly. And Rosalind, I can't help but noticing your UAB Alumni Cup there behind you. So very nice touch. Thank you very much. So you told us a little bit about who you are, and thank you for that. Tell us a little bit about your career path. After you received your MPH in International Health and Epidemiology, how did you get to where you are today?
Sure, I'll be happy to share that. Shortly after graduating from the School of Public Health, I was able to obtain a position at the UAB School of Medicine, Division of Preventive Medicine, working under Dr. Mona Fawad in her Recruitment and Retention Center. I was able to lead a number of different clinical recruitment efforts, getting participants involved in research studies. Those were wonderful opportunities to exercise a lot of the skills that I had just learned in the School of Public Health. A wealth of information and experience came from that. Shortly after working there, I was able to get a position in Houston, Texas at an organ procurement organization called LifeGift. I worked there as an in-house coordinator. It was a very clinical role. And that is where I first got my passion and love. And I learned a lot of strengths that I had when it came to working with the public. And through that training out there, I became confident to apply for another position very similar to that position here in Georgia as a family care coordinator. And as a family care coordinator here for LifeLink, I was able to contribute a lot, again, through the skills that I learned through the School of Public Health. And I am now the assistant manager of the department.
Fantastic. And congratulations on your upward trajectory there at LifeLink. So tell us about some of the experiences that you had here at UAB. It was just a little while ago. It probably seems like yesterday. What experiences do you think made you successful in your career?
There were numerous experiences that I had the opportunity, and I'm sure many of your students have those same opportunities to partake in. One of them was getting involved in the Student Government Association. I was able to serve as the School of Public Health Student Government Association president. And during my time there, I worked very closely with Dean Eli Capiluto and the Assistant Dean, Donna Peterson. I learned a tremendous amount of leadership experience being able to serve the student body during that time. That was just an awesome time and a very good experience that gives me leadership skills that I'm sure that I'm pulling from today. Other things include able to do CDC and the CDC Centers for Disease Control internship in human subjects in the Office of the Deputy in Atlanta, Georgia. I was able to co-author on a paper for the inclusion of women and minorities in research protocol. And during my career, I see a pattern of working in areas of disparity and inclusion projects. And through that, I was also able to complete my master's in international health. And a part of that was working abroad in the city of Guatemala. So just a diverse experience of research and community, UAB community type experiences that I take with me today.
Very broad set of experiences indeed from your international health interests and your experience in Guatemala, but an important experience at CDC, and we're going to come back to that a little bit later in our conversation. What about some of the skills that you gained while at UAB in the School of Public Health and how those have impacted your career?
A number of the positions that I've held since I've left the School of Public Health has had some component of data analysis. I think for anybody in the public health field or in research in general, those skill sets from those biostatistics classes are immeasurable. You're constantly looking at data and making sure that that data means what you think it means, and being able to give it a critical review, to be able to make operational needs. That type of skills, those type of skills that I learned from my public health classes, specifically, we had database classes, SAS classes, building databases for my internship. That was my responsibility of building research projects, utilizing databases. Even when I was in Guatemala, that was something very important, is being able to keep clean data and to be able to analyze it in a way that it makes sense and that you can make actionable decisions based on that data. That was, I would say, one of the most important skill sets that I take with me through every job that I've had since I've left, graduated from the School of Public Health.
Wow, I hope if students remember one thing from this conversation, that they'll remember your comments about data-informed decision-making and how your MPH has equipped you to do that. So we're gonna talk a little bit more in detail about your current roles at LifeLink, and I'll circle back to the question about skills specifically as they apply to LifeLink at that point. What, in whether in talking about LifeLink specifically or in talking about nonprofit community organizations generally, what advice would you give to a current student who's interested in working in such an organization?
I would say one of the most important things is to develop your communication skills. Definitely is a plus for working for nonprofit and probably for any industry, but definitely for nonprofit. Volunteer, get to know the companies that you may be interested in. And rather than chasing a job, chase a mission. What I love about LifeLink is that it has an amazing mission of saving lives that goes beyond than just getting up and going to work every morning. Every day, I know that I have a mission to fulfill and that it has an impact on people every single day. So that was important to me. That is what was important to me. And if that is your mindset, then I think nonprofits often do have very strong missions. And that might be something that you want to investigate and look more into. And just see if a nonprofit, by volunteering and asking questions, is it a good fit for you?
Now, get your foot in the door. That's such an important piece. And what a profound statement. Rather than chasing a job, chase a mission. Thank you for that. Thinking back to your time at UAB, is there a single course that stands out for you which prepared you maybe more than any other that at least comes to mind?
And there were so many courses that I think over the time at UAB that added to who I am as an employee and as a leader. One of the courses that I found invaluable and that I still reflect upon, it was an advanced level course during my last quarter actually there. It was with Dr. Stim Verman, and it was more of a critical thinking course where we were able to look at papers, peer reviews, and he led us through dissecting the information that we were reading. And in this day and time, those type of skills are so important, being able to critique information and data that is laid before you and deciding on how the study was done. Was it done with a representative sample? What the methods were? And are these conclusions actually a real correlation to what the presenter is actually trying to tell you? So I really found that course to be, yes, one of the most valuable. And it was a very small course. It was a lot of interaction directly with Dr. Verman.
Fantastic. Rosalind, with your permission, I'll pass along those comments to Dr. Verman, who is now Dean of the School of Public Health at Yale. So I'm sure he'll be delighted to hear this from you.
Thank you.
You're welcome. What's one thing that you wished that your faculty advisors had told you that could have prepared you better for life after graduate school?
Dr. Pauline Jolly was actually my faculty advisor, and she was amazing. She was very attentive and always available to ask questions. And it was because of her that I had the opportunity to apply to the study abroad program in Guatemala. And through those relationships with Noel Solomon and Dr. Mazariego in Guatemala City, that gave me just an amazing experience. As I reflect back, I don't remember or wishing that I had been given any advice, but advice that I would give to students who are studying currently in the School of Public Health is to use your time wisely. There's lots to experience, lots to take part of, but definitely you're going to be future leaders and you're going to have to make very important decisions one day. now is the time to get all of that information, learn as much as you can, so you're prepared to pull from those skill sets when the time comes.
Fantastic. I'm going to pause here for a minute or so and see if we have any questions from our audience. I don't see any yet, Lisa, in the Q&A box.
No.
We can still pause for a minute here and encourage those of you in the audience to send in your questions or comments, and we'll take them as they come in.
Dr. Irwin, I do have one question.
Please go ahead, Dr. Coleman.
You know, you mentioned a while ago that you did your internship at CDC, and maybe in a little bit different area than what you're working in now. And, you know, our students sometimes are always looking for the perfect internship, but sometimes the internship that, you know, may not think fits your interest area really can help you develop skills that you need once you identify what your career path is going to be, because so many of our students don't even know what that career path is at this point. So could you talk a little bit about, any skills or things that you learned in your internship and how they've been able to translate to what you're doing now?
And you're exactly right. Oftentimes, when I was in the School of Public Health, I wasn't sure what the future held, what kind of job that I was going to get. And I can't imagine that there was going to be a job or a position called a family care coordinator position. But interesting enough, my work within the Human Subjects Department, which is the protection of human subjects, making sure that research protocols are done appropriately for introducing participants into study. That I never thought that on my current job, I deal with authorization when it comes to building policies into federal regulations about what authorization processes that we must follow when talking to potential donor families. And the policies for every state is different when it comes to organ and tissue donation. So it's very important knowing where these things originate from, and the CDC takes some leadership in that, and people look to them for the gold standard of what to do. So having to pull on that type of experience was not something that I even imagined that I would be using or utilizing the way that I am in working with families and making sure that my team are following federal, state, and hospital policies. It's eye-opening that what you think you may never use is something that you never know how you're going to end up pulling from those experiences.
We're particularly challenged in this current setting of COVID with internships. And that makes Dr. McCormick's question all the more, I think, relevant for what we're currently facing. Well, let me shift then to have you talk about some former career positions and questions. I see that you worked while you were at UAB. You mentioned, I think, the Department of Preventive Medicine. While you were getting your master's. Can you talk about how those experiences influenced you?
Yes, I certainly did. I worked in the Department of Neuropathology shortly throughout my undergrad career and a little bit of my graduate career. And then shortly after graduating from the School of Public Health, I was able to obtain a position as I said earlier, at the UAB School of Medicine, working under Dr. Mona Fawad. But actually in my undergrad, while I was getting my master's degree, I was actually working in the Department of Neuropathology. I still was working in the laboratory. And so that's interesting. You should ask that question, Dr. Aaron. When I was trying to make a decision of where I was going to work, I looked at postdoc programs, and I was heavily involved in bench work and laboratory work. But I was able to kind of balance that I did realize that I truly did love engaging with the community and people, and public health was a perfect match for that. And that is one of the decisions why I made the decision to pursue a public health degree.
Rosalind, you started working at LifeLink in 2005. Can you tell us about what first interested you in LifeLink and your progression within the company?
So I would say prior to coming to LifeLink, I was out in Houston working in a very similar position at LifeGift. I knew what the mission was. The mission of saving lives is a national mission. And just to inform the audience, approximately 110,000 people are waiting for life-saving transplants as we speak. 21 people die each day. I know the impact that having education, having information, having support to be able to make the decision to say yes. I know how important it is for families and for hospital staff to get that information. And from working out in Houston, I realized that I was really good at this. I was really good at building rapport with family. I was really good at doing presentations and working with hospital staff, letting them know when to make that important phone call to us and how important it was, and inspiring families to want to leave a legacy for their loved one, want to have to make an impact and a difference in someone's life. Most people having the opportunity to save a life, they want to. Sometimes there are barriers that they must get past in order to be able to do that. And my skill set that I brought to the table was definitely pulled from a lot of the skills that I learned in the School of Public Health. Part of that being health behavior, being able to meet grieving families where they are, being able to make sure I have the appropriate information. Timing is everything when it comes to working with hospital staff and working with donor families. So when I looked at LifeLink, it gave me the opportunity to really expound upon that. When I first got there, there were only 5 family care coordinators. So it's a small industry that has changed quite a bit over the 15 years that I've been there. Now we have more than double that staff. We all come from a diverse group of backgrounds. My manager has a medical degree. My colleagues have nursing degrees. We have people who have public health degrees, but a very diverse background that brings all of our skills together to be able to serve this mission. And I'm just very humble to be a part of that. LifeLink is a wonderful company to work for. And I've just had an amazing experience while I was there. I've had the opportunity to create, to develop, using my public health skills. There's no one there to write the book for you. So you write the book yourself, you build on experiences and your knowledge and background. They're depending on you to bring your skills to be able to create and develop things that are going to push the mission forward. And LifeLink has given me that opportunity. I'm a part of their training and development of the staff, and I have been for many years. And through that, I've been able to serve on many committees. For the United Network for Organ Sharing, I was on their Minority Affairs Committee. And this is getting the word out, using data and information, educating people on how to get listed, the myths and the barriers that are out there that we must educate and show the public what it means to be an organ donor and how they can be an organ donor and how many lives that can be saved.
Rosalind, if I may ask you to expand upon that last part of your comment, the myths and the barriers about organ donation. Would you mind talking a little bit about that, please?
Sure. Some of the myths that families have is that, that their care would be stymied because they've made the decision to be an organ donor. And that's definitely not true. Hospitals and doctors and nurses do everything they possibly can. We don't talk about organ donation until a family is actually ready. We work very closely with the hospital to make sure that the timing for these conversations are appropriate. There are myths that if you sign your driver's license, that life-saving measures would not be taken. And that's definitely a myth. Signing your driver's license only lets your loved ones know that you've made the decision to want to save a life when yours has expired. Some of the other myths is that you can't have burial and funeral arrangements, and that's certainly not true. You can have very appropriate burial and funeral arrangements and be a donor. No one would know you were a donor besides the funeral home that made preparations. So, and then there's other myths that I will speak to that, there are definitely policies and procedures to how all organ procurement organizations work. And that is with integrity and respect for the gifts that families give each and every day.
Great. Thank you for.
I hope I answered your question there.
Absolutely. That's perfect. Thank you for that. Those myths are things that I've heard in my current role and in my previous role as a clinician, concern from families who were on their way to experiencing the death of a loved one. And I think what you have given us is that there's so much good in organ donation, and that taking time to talk with someone such as yourself who can answer and respond to those questions about myths. So thank you so much for allowing me to ask that question. I'm going to jump back one more time to internships, and after that, then we'll see about the questions. And so, you did your internship. At least I think you did multiple internships, but at least one at CDC. Can you talk a little bit more specifically about that experience? Who was it with? What did you do? And how did it help you grow?
Sure. So I worked with Dr. Deputy Marjorie Spears. It just so happens that she had been recruited by the Clinton administration, I think at that time. So she was working out of DC. So we stayed in contact remotely. I actually took her office while in her absence. And I worked with the Department of Human Subjects to develop a protocol to investigate the inclusion of women, minorities, and children in CDC-related research protocols. So part of that internship was me being a part of their institutional review board committee. So I was able to attend the committees where they decide which projects would get approved and not approved and what is the approval process. So that was very interesting to be a part of that. So I got to see proposals from around the nation, but mine were specifically for CDC related protocols. And so I abstracted data through a query and search with the help of the staff there at the CDC, and collected that data to be able to show how good they were doing with the inclusion of women and minorities in their research protocol. There was an internal paper written regarding that, and the conclusion basically was that there's room for improvement when it comes to inducting minorities into research protocols, as is with women and children. Oftentimes, as you can imagine, what's currently going on, the general public is where all of the resources go when determining whether vaccinations or health interventions work. But it is very important that that minorities and women, and especially children, are part of those clinical trials to determine safety and effectiveness of those interventions or those medicines. So that is something that was very important to the CDC at the time that I was there. I was able to, like I said, attend those institutional review board meetings and a number of other meetings that I was able to partake in. But being able to co-author a paper with Dr. Spears was a great experience. And I would say I take that with me today. Working in my prior job after leaving the School of Public Health with Dr. Mona Fouad, who is an amazing researcher there at UAB. She's done numerous studies throughout the minority community there in Birmingham and abroad, I would imagine, working with the Deep South Network for cancer prevention. The same pattern of working in areas of disparity and where there is a need for health promotion and health information, taking those experiences from what I did at the CDC of that inclusion project and being a part of cancer awareness projects. I recruited approximately 18 participants in the small community of Fairfield in Fairfield, Alabama, to be community health advisors and training them into doing monthly self-breast exams and promoting in their community getting a yearly mammogram, which saves lives. So all of those health promotion type activities and interventions that are able to be a part of, makes what I do today so much more enriching because I have that experience.
Oh, and what incredible relevance to what we're facing right now with the COVID pandemic that has disproportionately affected communities of color, and we still struggle with getting communities of color to participate in research for many historical reasons that include discrimination and racism. I'm very fortunate to be in a school that has large studies such as regards and rural that focus very strongly on including communities of color in their research, and can all the more appreciate what your internship must have been like for you. Well, let's stop just for a minute or take a pause and see what we might have in the Q&A box there.
Yes, Rosalind. Dr. Swatzel put a question in, and she's teaching our MPH capstone course this semester, and those students are going to be listening, if they're not already, to your career conversations. She wants to know, in these challenging times for public health professionals, what suggestions might you have for students who want to advocate for evidence-based public health and to communicate health messages to communities who are not always receptive or who may even be opposing an issue? Have you had to face that in your current position, and how do you think that translates to what's going on with COVID?
Wow, well, what an interesting question. I won't say that I've had a lot of experience directly with that, but I will say this. It is very important that if you have a voice, that you use it. It has been imperative upon the organ procurement organization across the nation to make sure that we're doing our job in providing education and providing feedback to make sure that we're in compliance with providing organs for transplant. So that is something that on a daily basis that we are challenged with. And yes, these challenges continue within the pandemic. We are still transplanting patients and making sure we still follow all the policies and procedures that are laid before us. Advocacy is very important. It is very important for LifeLink when it comes to making sure the federal regulations and policies on who can say yes to organ donation. That is done through making sure that our lawmakers and our senators are supporting us in these endeavors to be able to uphold the donor registry. That is something across the nation that we've been able to do through advocacy and through the public outcry. When you place your name to say that you want to be a registered donor, for every organ procurement organization be able to honor that decision. I would say the skills in public health will help you build these campaigns. I mean, we have a whole department within our LifeLink community that works specifically on that. That is not my area of expertise, but I definitely am a supportive member of that, of making sure that we are advocating for those people, for those patients that are listed. And when I'm speaking to potential donor families, we advocate for the donor, but we also advocate for the recipients, which is also a very important part of my job. And there are opportunities beyond that where there's different laws or different barriers that might come up that would prevent organ donation. And we pay very careful attention to that and making sure that we're staying abreast of that and staying in connection with the community. And then Dean Aaron, you mentioned early when it comes to the minority community, that is something very important for minorities to stay informed in that and to know and to have the most updated information when it comes to organ donation, to be able to make that important decision. And oftentimes it's better to be able to make those important decisions before they get into a very grief-stricken situation. To be able to hear it from their community leaders is important. So I would say to that question, definitely become involved in the community. There's several different ways of reaching out to your representatives and your senators to making sure they're representing your beliefs.
I meant to say earlier when you commented on the importance of Dr. Pauline Jolly to you as she served as your faculty advisor. She's now Professor Emeritus, but I will be sure and pass along your comments to her as well. So thank you for giving her a shout out there. Let's take the next 5 to 10 minutes and dig deeper into the day-to-day work that you're involved in. So what is a typical day, if there is any such thing? What does a typical day look like for you? You know, what do you do on a normal, typical day?
When I read that question, I kind of laughed. I won't say there's ever a normal, typical day. As the assistant manager, I still take call, which means that I still have a 24-hour response to get to the hospital of someone who or a family that needs me or to evaluate a potential case for organ donation. So I won't say any day is ever typical, but I will say that is what I love about what I do. No day is ever typical. No family is ever typical. We serve 193 hospitals in the state of Georgia.
Wow.
Every hospital system, every culture is different. So depending on if I'm at Northeast Georgia or at Grady or at Kennestone, every hospital system is vastly different. They come with their own policies and procedures. And part of my job is making sure my staff is equipped with the information and tools they need to be able to move the organ donation process forward. And also getting feedback from them for process improvement, making sure that if something didn't go like we wanted it to go, that we have things in place to make it better. So no day is ever typical, but we do start off early in the morning. Our staff meets as a group on a conference call at 6:45 every morning to discuss how we're going to start the day with triaging staff to hospitals relieving on cases. Our transplant coordinators who work with our staff are our unsung heroes, along with the family care coordinators. I will have to say all of our staff, our surgical coordinators, to students who are interested in this career path, there's so many potential places to find an impact. And I will say the staff that I work for and with and alongside, they are truly amazing in what they do. They are leaders in their jobs. They're working constantly, again, at different hospitals, never knowing where they're going to go each and every day, never knowing the families that they're going to encounter. And a lot of times these are very difficult situations, very sad, things that you never imagine. But being able to be that sense or that presence of hope for these families, that is what our mission is. And that is what drives us each and every day. Other than that, I attend a lot of meetings. I chair and facilitate a lot of committees. And I try to stay very involved and connected with my staff in making sure that they have what they need. And as you can imagine, being in very stressful and traumatic situations, making sure they get the downtime that they need to recover for that.
I can only imagine the stress because of the circumstances that your coordinators face. And did you say 6:45 a.m.?
6:45 a.m. is when we have our all staff call.
My goodness.
I was going to staff that make sure everything works like clockwork.
Wow. My next question was going to be to ask you to talk about some of the challenges you deal with at work, but being prepared for a 6:45 a.m. call every morning probably takes that question off. I can imagine that may be a challenge, but
I will say, depending on my schedule, Dr. Aaron, those 6:45s depend on the schedule for today. But
yeah.
At LifeLink, yes, that is the goal, is to be able to figure out what's going on within the company.
But I do want you to talk about challenges that you're facing, and you can talk about this pre-COVID, but especially in the context of COVID. How has that changed how you do your work?
Sure. So one of the most important things for families being able to say goodbye to their loved one and say yes to helping someone else is having the most updated and accurate information regarding what happened to their loved one, what is the cause of their injury, or why they're receiving very poor prognosis. In this environment of COVID-19, a lot of these conversations are happening virtually. Doctors are talking to families over the phone. There can only be 2 visitors per day for 1 hour a day in some cases. It's heart-wrenching to see families not be able to visit their loved ones like they would like to for an extensive period of time. Of course, that's all understandable for the protection of hospital staff and for them and for patients. That's very important. However, what comes along with that is not being able to give that handshake or that so needed hug that these families need. And oftentimes my staff, we will do FaceTime or we'll do some type of virtual connection. And then sometimes it's a telephone call after they've received some very bad news. So definitely a different environment that we have done everything possible to meet those challenges and make sure that we're still reaching out to these families and supporting them in any way we can. And part of that support also includes helping them, making sure they get information about how what kind of donor their loved one is. There's nothing more helpful for families to receive that letter in the mail, letting them know a little bit about the gifts that they were able to give to someone else who was waiting.
What do you like most about your job, Rosalind?
I think I mentioned it a little bit earlier. I like that it's different every single day. Like nothing I've ever done before. And I like the mission. should say I'm very passionate about the mission of what my job brings. It's more than just a job. It serves an impact when families get the opportunity to meet the recipient and know that their loved one lives on and their legacy lives on. It is an amazing opportunity to be able to work for a company that gives you that type of impact. So I have to say that would probably be the most important thing that I like about my job.
I'm going to circle back to earlier questions about your MPH and about skills, and to have you talk about the skills or what you learned in your MPH that you use in your current position.
Skills that I learned in my MPH that helped me in my current position, again, I will say the leadership skills were instrumental in to what I do each and every day. Being able to have an influence, and you don't necessarily have to be a manager or a director to be able to have an influence. And those skills that I learned in the School of Public Health, I think laid that groundwork for that. I can say my classmates, while I was in the School of Public Health, of course, School of Public Health is a very diverse group of students, but being able to have the experience of having that diversity while studying there and having their experiences and being able to be in teams and groups and presenting those interpersonal skills, as much as all the things that I learned about infectious diseases and health behavior and data and epidemiology, those interpersonal skills I have found to be invaluable to what I do today, and working with the greater community and working directly with potential donor families and hospital staff.
Let's do one more question before we check in with the Q&A box, and that's about community engagement. I mentioned in the introduction, you mentioned in your bio that you volunteer with Camp Horizon. In the School of Public Health, we encourage community engagement. Can you tell us about how that involvement has made an impact in your life?
Absolutely. So I will say, first of all, public service is just a part of who I am. And I have to give a plug to my sorority. I am a member of Delta Sigma Theta Sorority Incorporated. So throughout my time at UAB, I participated in public service. But I will say, when I moved to Georgia, I was looking for something, again, that had an impact. And I volunteered for a camp called Camp Wanaclot. And through that camp, I found Camp Horizon. And Camp Horizon is a camp that is dedicated to restoring the dignity to those children that are in the Georgia foster care system. And they've been around for many years. I've volunteered to be a camp counselor at least 7 years. I've gone out to Camp Twin Lakes to participate as a counselor with camp staff. I've been on their advisory committee. I've been a part of their board. I've been on their planning committees. Just an amazing camp with, again, an amazing mission. And for me, the camp also gave me more than I could ever have given it through the opportunity to volunteer. Amazing group of kids. And it just showed me that there is such a need for advocacy for this population. Out of all the camps that go to Camp Twin Lakes that are a part of the greater camp community, Camp Horizon is the only one, of course, without parent advocates. So, of course, it's always a challenge to raise money and to promote the cause for making sure they have a good Christmas, birthdays, outings, mentorship. And even when they graduate from college, as you know, no one at 18 or 19 is truly an adult. They still need guidance and mentorship internship. So this camp gives that to a number of kids within the Georgia foster care system. So an amazing mission. I'm very glad to have had the opportunity to be a part of it and to learn more about the children that are in the foster care system. And it hit homes firsthand, working in organ and tissue donation. I've seen the effects of child abuse and the outcomes, which are not always good. And if we fail these children, it's us failing them as a community. And as you said before, whenever one of us hurts, all of us hurt. So we're all responsible for our community and making a difference in these children's lives. And that is something I take to heart. And I continue to support them as many ways as I can.
Well, thank you for those words. I am obligated to my community. That's profound. So thank you for that. Let's check in with the Q&A box there, Dr. McCormick.
Yes. So do you have any advice for students who are graduating this semester and looking for jobs in the midst of the pandemic?
Wow, interesting question. I will say healthcare is still a great field to be a part of. Your skills are sorely needed. So I encourage them to investigate opportunities, look for opportunities to volunteer. Those volunteer opportunities, if you're able to, those will give you invaluable skills that turn into real life experiences when you're interviewing for a job or a position. Take your time, ask questions, ask the shadow just to see what it's like to be a part of a potential job that you might be interested in. Talk to people who do the job. And then now we have so many social networking platforms. Those are also very important places to find out more information and connect with others who are actually doing the job. But I would say in the healthcare field, there's lots of opportunities for the job market. I will say that. So good luck to those students who are endeavoring into this new world. These are still exciting times, and we need your skills and leadership.
Rosalind, we've got a little less than 5 minutes, and while we're still monitoring the Q&A box, let me ask this: how can the audience find out more about organ donation?
Sure, you can go to LifelinkFoundation.org, and you can also look at the national site, UNOS.org. UNOS stands for United Network for Organ Sharing, but UNOS.org can give you more information. And if you should find out information, and you decide you want to become an organ donor, talk to your family about it, talk to them about the decision you're making. And then if you decide you want to register and put it on the registry or your driver's license, you can go to registerme.org. And at any point in time, Dr. Aaron, if any of your students have any questions, feel free to reach out to me. Okay, I'm going to ask you to repeat those two links that you just gave us. So the first one was LifeLink. LifelinkFoundation.org. Okay. LifelinkFoundation.org. And then UNOS.org, UNOS.org. And then if you want to get registered, registerme.org. Okay, great. Thank you so much. Lisa, are there any more questions coming in yet? Nothing yet? So I'll ask Rosalind, if students want to learn more about organ donation and the work you do, may they contact you by email? Absolutely. Thank you. Thank you very much. And just for everybody listening, I wouldn't have put her on the spot for that question. She wholeheartedly agreed to this earlier, but I wanted to make sure that those who are participating know that they can contact you, Rosalind. That's another incredible characteristic of our alums, just this willingness to be a part of the School of Public Health Network and to lend a hand. That's what makes a difference. Thank you, Dr. Irwin, so much for inviting me to be a part of these conversations and being able to connect with your students. I'm very proud alum, And any opportunity I have to offer any advice or any opportunities to these students, you can call me anytime. Thank you.
Great. Well, on behalf of the school, on behalf of the Office of Public Health Practice and the Public Health Student Association, thank you so much, Rosalind Robinson. Thank you, Dr. McCormick, as well. We're so proud of and for you.